So the topic that I've chosen to review is traumatic brain injury. Um, this is something that I have seen a lot of working with veterans. Um, Usually, traumatic brain injury occurs from a violent blow, a jolt to the head or the body. The object that goes through the brain tissue can be a bullet, shattered pieces of the skull, can also cause brain injury. So sometimes motor vehicle accidents, blast explosions, any kind of outside trauma that really creates that um, jolt to the brain. So mild traumatic brain injury can affect your brain cells temporarily. More serious injuries can result from bruising, torn tissues, bleeding, and other physical damage. Sometimes these are short term effects, and then sometimes they are long term. One of the initial symptoms that people complain of happens to be uh, seeing stars, being knocked unconscious, um, memory losses. So, some of the initial symptoms that may occur, and it can happen um, days or even weeks later. Physical symptoms, they can be the headache, nausea, vomiting, kind of like a concussion, fatigue, drowsiness, speech problems, dizziness, loss of balance. They may also have like ringing in the ear, tinnitus, um, changes in their mouth or their um, ability to smell, so the olfactory um, nerve can be damaged. They may also have blurred vision, sensitivity to light or sound, and so a lot of these people suffer from migraines and everything else afterwards. Cognitive behavioral mental changes, which can occur, are, as I said, being dazed, confused, loss of consciousness. These could be like immediate, either seconds or minutes afterwards. Memory concentration problems, they can have mood changes, mood swings. Usually they can have depression, anxiety, insomnia, or sleeping more than usual. Moderate to severe brain trauma occurs usually from swelling that doesn't go down right away. Uh, it can be within the first hour to days afterwards. Um, Persistent headache or headache that worsens. Like I said, they have the persistent migraines, repeated vomiting and nausea, convulsions, seizures. Some of them have to be on anti seizure meds just to control that. Dilation of one or both pupils of the eyes, clear drainage from the nose or ears, which we know is cerebral spinal fluid, inability to stay awake. They can have weakness or numbness in their fingers and toes, loss of coordination, usually of the brainstem is damaged. There can be cognitive and mental symptoms afterwards, uh, the combativeness or profound confusion. Now, some of the other things that can cause it, like I said, usually I deal with it in our veterans that have been exposed to blast explosions, sometimes motor vehicle accidents. But in the community, we're probably going to see more injuries from sports. Um, Recently, the football player that had the um, damage from his brain and the swelling, and then he ended up getting injured again. Violence, domestic violence, it can be shaken babies also experience this, gunshots, um, physical blows, bicycle accidents. And then one of the most common ones you're going to see, especially in the elderly, is going to be falls. So it may be a fall from the ladder, downstairs, the bath, um, or other falls. I actually witnessed a neighbor fall off a ladder on a second floor building, and he ended up having some traumatic brain injury afterwards. So, some of the risk factors for this is young adults, males, because they're supposedly more risk takers, and then adults age 60 or older. And as I said, the complications can occur immediately after, or it can be several days afterwards. Injuries can range from mild to very severe. Sometimes people go into comas and they aren't able to come out of it. Vegetative states is one thing. Even though they may be unaware of the surroundings, they can open their eyes, make sounds, respond to reflexes, but there's really not a whole lot of brain activity going on at that point. And then brain death when there's no activity to the brain, whatever, in the brainstem. So some of the physical issues from afterwards, as I said, the seizures, that's a big deal. And that can continue on for many years. The migraines. Some people may suffer from hydrocephalus, which is the cerebral spinal fluid buildup in the brain spaces. And that can cause the pressure and swelling, which may need to be drained. Sometimes they can have infections with the skull fractures or the penetration of the bone into the layers of the meninges. That allows for bacteria to enter and cause infections. There can be blood vessel damage when several or small, large blood vessels are damaged. And if that's not treated right away, as we know, when the clot heals around it to stop the bleeding, that clot may break loose and cause a stroke or other issues. The headaches, very common and can continue for years. Vertigo, that's another very common condition where they're just dizzy. They don't feel like their balance or the coordination's all there. And then, as I said, damage at the base of the skull and the cranial nerves can cause paralysis of the facial nerves, loss of sensation in the face. It can damage the olfactory and the taste. You can lose vision, have double vision, difficulty swallowing, tinnitus, the ringing in the ears, hearing loss. And one of the other things that I've seen quite often is the changes in cognitive skills. So it's more difficult for these people to concentrate. It's more difficult for them to process what you're asking them. And if you ask them a question, you may say pause, and it may just seem like the wheels are turning a little bit slower at that time. Just be patient and allow them time to express themselves. There's memory issues, learning issues, reasoning, judgment, attention and concentration issues. So, as you can see, people that were very high functioning, you might find if they have a more severe damage to the brain after the trauma, they may require a lot of assistance going forward. Simple functions like problem solving, math skills, multitasking, planning, completing simple tasks, or even just recognizing right from wrong. Those are issues that may occur. And then communication problems, there could be some barriers there as well. Just like when people have strokes, with any brain injury, there may be difficulty with speech or writing. They may either understand what you're saying and not be able to speak back or communicate properly back, or they don't understand what's being said. Everything's like kind of jumbled up in there, but they're able to say what they need to say or get their ideas across. It's very difficult for these people to socialize sometimes because they have trouble just following the conversations, being able to recognize other people's bodily cues, and being able to express emotion properly. Um, they don't always understand those nonverbal signals. Um, and this can also lead to a lot of behavioral changes. They have anger, mood swings. There can be a lot of anxiety and depression, irritability. If that part of their brain that tells them what's right for wrong or anything like that, it may lead them to have a lack of empathy for others. Um, they can have difficulty with self control, lack of awareness of their own abilities, risky behavior, difficulty with just verbal or physically outburst. Um, Other issues with sensory is that tinnitus, that really annoying ringing in the ears that doesn't go away. Difficulty just recognizing what an object is. Um, like you could hold a pen and they won't be able to tell you exactly what that is. Uh, they can have impaired hand-eye coordination, have those blind spots or the double vision, skin tingling, and then for diagnosis, if we're moving through the process, in the emergency situations, very in the beginning, it's important if you're able to treat those quickly so you can prevent the injuries from becoming worse. First off, you're going to start with a Glasgow Coma scale, 15 points, or means the less severe injuries, and then the lower scores from like 1, 2 on up. Those lower scores mean that there's been quite a bit of injury there. They also want to do a CT scan so they can identify um, any hemorrhaging, hematomas, which is the blood clots, or the contusions, which is the swelling, bruised brain tissue, and they want to identify brain tissue swelling. Very important that they're able to treat those quickly, that they're able to release that pressure to prevent and stop the bleeding to prevent further damage from going on. They might also do an MRI just to get a more detailed visualization of the brain if after they've been stabilized, they have symptoms that haven't improved. They can kind of compare. Um, let's see what else. For mild injuries, they'll just need frequent follow-ups with doctors. They may need physical therapy, occupational therapy to regain their um, highest level of functioning again. They may also, most likely, most of them will need mental health therapy and stuff just to process what happened. On top of all of the damage, they may have post-traumatic stress disorder, and then just having those difficulties with social situations afterwards. Um, some of the medications, besides I mentioned the anti-seizure drugs, uh, they may use diuretics to kind of reduce the pressure, help relieve that fluid, besides doing shunts to remove excess fluids. Other surgeries that may be done is removing clotted blood, just to prevent that from breaking loose and causing a stroke. They may have to remove a skull fracture. Sometimes they'll put metal plates in there. If there's bleeding in the brain, they may need to do the clips um, to keep that from causing further issues. Um, if they need to relieve pressure, they'll open that little window. They'll cut a little area, and that's where I said like the shunt, just to kind of release that cerebral spinal fluid. And Overall, just quick, adequate care, emergency care, and then follow up. If it's moderate to severe, even with mild, as we saw with the football player recently, you just need to be very aware and have those follow-up visits and monitor for any future injuries. You want to prevent those. Um, Other people that may be involved, vocational counselors, if they need to find a new um, work activity, if they're not able to pursue their previous employment, they may need a social or case manager to help them with just finding excess services. And I think I didn't mention speech therapy because that's a big one if they're not able to um, communicate properly, and then also with any swallowing issues. Um, Last of all, you want to prevent those injuries from happening in the first place if possible. You want to prevent secondary injuries from happening because with one traumatic brain injury, any progressive ones after that are going to be much worse. So always wearing seatbelts, educate your patients, always wear their seatbelts, always wear helmets when they're on motorcycles, if they're on bicycles, roller skating. Teach them to avoid alcohol or drugs when they're driving, even prescription medications that cause drowsiness. We want to educate them not to get behind a the wheel and drive. Also, um, just fall prevention. You want them to make sure, especially for elderly, there's no hazards around the house. They can have an occupational therapist come in and look around for safety issues. Installing handrails in the bathrooms, um, putting non-slip mats in the bathroom or the shower, removing any loose rugs, um, making sure there's adequate lighting in the house, and then just making sure that there is no clutter just laying around the house. Um, and that is about everything on traumatic brain injuries. Thank you.